Hey everybody, my name is Sean Buckles and I'm the Chief Data Officer at the Federal Housing Finance Agency, and it's my privilege to welcome you to today's session of the American Community Survey User Conference titled Combining ACS with Other Survey or Administrative Data. We've got a great session today for you. We are going to start off by hearing from Kate Nesi, who's going to deliver a presentation titled Parcel-Based Estimates of Population for Non-Standard Geographies, Combining Data from the ACS and County Assessor's Office to create accurate estimates of children and adults. We're then going to hear a presentation from David Powers entitled Social Determinants of Emergency Department Utilization in Utah. And then finally, we're going to hear a presentation from Douglas Hilmer entitled Linking ACS Data to Data from Other Sources, Issues to Consider. I want to remind the audience that you can submit questions via the question box at any time during any of the presentations, and that we are going to wait till the final presentation is over before we ask the speakers to answer your questions. So with that, I am going to turn it over to Kate Nesi. Kate?
Thank you so much. Let me share my screen. All right, so as Sean said, my name is Kate Nesi, and I developed a method for estimating population based on parcels for non-standard geographies by combining the American Community Survey information with data from the County Assessor's Office. And this is an age-old problem that many of you probably have encountered in your own jurisdictions. I work for the city of Bellevue, and in Bellevue we have a number of neighborhoods. Some of them conform to census tracts, but many of them don't conform to census tracts. And so we need estimates of population in these areas, but you know, we can maybe use census tracts or say it's kind of like this census tract, but it would be much better if we could actually have estimates of the actual numbers of people in there. So there is a solution that is quite old. It's called the housing unit method, and you take the number of units in the area that you are interested in, you multiply it times the average household size for that area, and you end up with the population. So for the census tract, so for the housing unit method, you can say the average household size for the census tract, so you can break it down a little bit more. You can say, okay, the average household size for a single family and multifamily units, and break it down a bit more. You can get even more detailed and do the average household size at the parcel level. So you can say the number of units on this particular parcel, the average household size for the census tract where the parcel is located. You can split it up into single family and multifamily. And then if you're at the parcel, you can build that up to larger areas like a neighborhood or other areas. The method that I developed is based on that housing unit method, but I break down those housing units even further than just single family and multifamily. So for the housing units, I have single family, 0 and 1 bedroom, single family, 2 bedroom, single family, 3 bedroom, and so on, multifamily, 0 bedroom, multifamily, 1 bedroom, and so on like that. And the handy thing about breaking it down by bedrooms is that there's a strong relationship between the number of children and the number of bedrooms. So if you've been downtown, in many of our city downtowns, you'll probably notice that there are not a lot of children living in studio apartments. But with the as the number of bedrooms increases, the number of children also increases. I don't think that's a causal relationship. I think the cause is the other way around. But there is definitely a relationship. And so I have the average number of adults in housing units for the number of bedrooms separated by multifamily and single family, the average number of kids. But as I was looking at the city of Bellevue, I noticed that irrespective of the number of bedrooms in an area, some neighborhoods just had larger household sizes than other neighborhoods. And so I developed an adjustment factor that I multiply times the number of adults and the number of children. And that adjustment factor is just the ratio of the average household size in the census tract to the average household size in the city as a whole. That adjustment factor adjusts it just a little bit up or just a little bit down in most cases. And then finally, of course, we're not at 100% occupancy in all of the areas. Some areas have higher vacancy rates than other areas, so there is a occupancy adjustment factor as well. So I wanted to see, okay, this is a great method. How is this actually doing in estimating the population? So I wanted to compare it to another estimate of the population that is accurate, but is estimated in a different way. Every year, the state of Washington Office of Financial Management estimates the population based on births, deaths, and migration. They do include a land use element in it, but it's primarily births, deaths, and migration. So for the city of Bellevue on April 1st of 2020, they estimated a population of 148,100 in the city. The NISI method, the method I developed, I estimated 148,489, and the difference is less than 0.5%. So yay, that was good. That was very affirming for this method. So where does all of this data come from? Well, I've alluded to it. I've mentioned this at the beginning of the presentation, but the housing units and the number of bedrooms comes from the county assessor's office. Bellevue is fortunate to be located in King County, which has very detailed and publicly available assessment records. You can download the assessment files on the website. Very handy, not possible in all counties. Not possible even in all of the counties in our metro area. Another thing is that King County uses the number of bedrooms as a factor in its assessments. Not all counties do this. Some states and counties just use the square footage of the housing unit. And so this method would have to be adjusted if it's just the square footage. So the average household size based on the number of bedrooms, those are two questions that are asked on the American Community Survey. How many people live in this household and how many bedrooms are there in this household? There is not a table that you can download from data.census.gov that has a crosstab of these two things. However, you can use the IPM's microdata to find the average household size based on the number of bedrooms. The city of Bellevue has a PUMA that's sort of approximately the same geographic area as the city boundaries, not quite, but close enough. In your area, if you live in a big city or if you work for a big city, you may be able to have PUMAs at a sub-city level. And if you're in a more rural area, it might be that you're using a PUMA for a county or a multi-county region. I want to point out that it's important to look at the number of records in each of these categories, because we're dicing the data sample, the IPM sample, pretty finely. And so if you look at the 4+ bedrooms for multifamily, there's only 5 records there. So the average is not going to be very stable. So what I ended up doing is rolled that back into 3 bedrooms instead of 3+ bedrooms. And then I had a larger pool of records to make that average based on. Now the adjustment factors, they are available in the data.census.gov. Vacancy rate, there's not a table for vacancy rate based on multifamily and single family, but it can be created using two tables. Again, the average household size is also recorded at the census tract level and is available through data.census.gov for census tracts across the US. I do want to have a special shout out to table B25032. It's a very helpful table for converting tenure to structure type, because a lot of these characteristics are in tables that use tenure. And in this case, what we wanted to know was the structure type. And it's broken out. So depending on how you define single family and multifamily in your jurisdiction, you can break it out a little differently. So the result is a table that I developed for all of the neighborhoods in the city of Bellevue. And this is by far the most requested data that I have as a demographer for the city. I send this out all the time because the information at the neighborhood scale is very helpful for outreach. It's very helpful for policy work and many other applications. But in addition to having it at the neighborhood level, because it's at the parcel, basically at its most base level, it's at the parcel level, I can build it up into all kinds of different geographies. So, for example, the fire department wanted to know how many people live in this area that it takes more than 8 minutes for a fire engine to get to. How many single family and multifamily units, how many people are in those units? And utilities has had a similar question. I've done these estimates for the frequent transit network, so the area within a quarter mile of frequent transit. I want to know how many people live in that area. One caution is because these are based on a sample and their averages on that sample, it's not advisable to take, a very small area. I usually say it has to have at least 1,000 parcels in it to be at all reliable. But for a larger neighborhood area or that type of thing, it's very useful. And so with that, I wanted to, here's my contact information. There is a paper that I uploaded a little too late, so it's not on the website, but I would be happy to send it to you. And look forward to your questions at the end. Thank you so much.
Thank you, Kate, for that presentation. Next up on our presentation list is David Powers, who's going to present a presentation called Social Determinants of Emergency Department Utilization in Utah. And I want to remind everybody that you can continue to submit questions via the question box, and we will answer all of those questions at the very end. So David, you are up.
Okay, I'm going to share my screen. So one moment. All right. Okay. Well, good afternoon. Thanks for joining. I'm David Powers from the U.S. Census Bureau. Today, I'll be presenting regarding social determinants of emergency department utilization in Utah. This is joint work with several co-authors. I especially want to recognize Sarah Robinson's major contributions. The standard disclaimer applies throughout my talk. So there are 6 parts to the presentation. And we'll start with the overview, then we'll go to data linkage. Then we'll go through the methodology, and then we'll go through some data confidentiality and disclosure avoidance. We'll talk about results, and then we'll talk about conclusions and next steps. So this project is one of many taking place under the Enhancing Health Data Program, eHealth, at the U.S. Census Bureau. In this program, we utilize existing survey and administrative records data, and we engage with new stakeholders to acquire health records. The goal is to improve the quality and availability of statistical information to better understand and advance population health. There's a potential to reduce respondent burden and data collection costs while hopefully increasing the quality of existing data. And of course, during the COVID-19 pandemic, perhaps these kinds of data and analyses could be even more relevant than before. So as background, in 2019, the U.S. Census Bureau entered into a partnership agreement with the Utah Department of Health, UDOH, and we had 2 aims. First, to examine social determinants of emergency department, that's ED, utilization in Utah in order to reduce preventable visits. And the second aim was to evaluate the utility of emergency department encounter data for surveys for which the Census Bureau collects data, so including the National Hospital Ambulatory Medical Care Survey, NAMSIS. And this presentation is regarding the first aim, examining social determinants of emergency department use in Utah. So the goals of this work are to understand person and household characteristics associated with preventable emergency department visits to inform policy, improve health outcomes, and increase cost effectiveness of emergency care in Utah. We want to also evaluate ACS survey content, increase utility of survey data, and create new estimates related to social determinants of emergency department utilization. We ask, are individual and household social level characteristics for social determinants associated with preventable emergency department visits in Utah? And if so, which social determinants are associated in Utah? And how do our findings compare with existing literature? So regarding our source data, we used 2013 to 2017 emergency encounters data from Utah's Department of Health, UDOH ED. This is a visit level data set. For our ACS, we used 2013 to 2017 ACS, restricted microdata from the US Census Bureau. And this is not the ACS 5-year product I want to mention. So we combine 5 one-years of data together. And this is a person and household level data set. So it contains about roughly 1 to 2% of the Utah population per year. And we link the Utah data and the ACS data using internal unique identifiers called protected identification keys. So here's a summary of the data and record linkage. First, in the Utah file over 2013 to 2017, we have 3.6 million records, and that comes from about 1.4 million unique persons. If you average that out, it's at 2.5 visits per person. And we actually have a very high match rate, a pick rate. So in terms of finding a unique identifier for those patient records, about 97%. And so that leaves us with about 3.5 million records from the Utah visit file. For the ACS, the person file, again, this is 2013 to 2017, but not the 5-year product. We get 375,000 person records, which is about 75,000 person records per year. And we're able to match 353,000 approximately person records at pretty much a 94% pick rate. So Again, a high rate of matching, finding a unique identifier for the data. And the linked file, when we combine the ACS and the Utah file, we have 230,000 matched visits. And that's over 98,000 unique patients. So many of the linked Utah and ACS data borrow strength from other years in the sense that we might have 2014 data linked with 2016. We might have 2015 in the Utah file linked with 2013 in the ACS file. And we're able to get a large sample that way. So we classified the Utah EdVisit data as follows. We use the NYU Ed algorithm to classify the visits. So we can see Billings et al. The NYU algorithm uses International Classification of Diseases, ICD codes, to classify ed visits into 9 categories. There are 4 main categories and 5 others. To determine if a Utah visit was preventable, we applied the algorithm to the Utah visits primary diagnosis code, including for 4 main categories. For non-preventable emergency care, there's care needed, not preventable. So a lot of times we'll construe this to be a true emergency visit. And then under preventable emergency care, we have 3 types: care needed, preventable, primary care treatable, and non-emergent. So those are the 4 main categories. And for ICD codes associated with multiple algorithm categories, we assign the visits to the algorithm's highest probability category. And if we have a 50%, we're going to randomize. To connect the emergency department visits to socioeconomic characteristics, we use a social determinants of health framework, which theorizes that an individual's health is impacted by conditions of the environment in which one works, lives, or plays. So we see at the World Health Organization 2008, consistent with the Healthy People 2020 framework, social determinants span 5 domains. So we have economic stability, education, social and community context, health and healthcare, neighborhood and built environment. So we select ACS measures from each of those 5 domains, and it ends up being 19 specific characteristics. And here's a layout of those 19 social determinants. So for example, under economic stability, we have employment. Under education, we have English language speaking ability. Under health and healthcare, we have disability status. Under neighborhood and built structure, for example, housing tenure, as whether you're an owner or renter. So our methodology for studying the social determinants of ed visits in Utah is as follows. For each social determinant category, and for each of the 4 emergency department visit categories, we compute the following 4 figures. The average number of emergency department visits per 1,000 people. We compute the percentage of emergency department visits across 4 emergency department categories. We study bivariate relationships between social determinants categories and ed use. We study results from logistic regressions built from stepwise regression and lasso to confirm the observed relationships in the presence of control variables. And ultimately, we also study characteristics of Utah emergency department patients relative to those in the overall Utah population. So data confidentiality and disclosure avoidance are among the Census Bureau's most urgent priorities and responsibilities. They get much of the time that we spend daily. Specifically, confidential data cannot be disclosed or published in any way that permits identification of a particular individual or entity. So these data confidentiality are maintained and guaranteed under Title 13 of the U.S. Code, Section 9, and the Privacy Act of 1974. I'll mention this project was approved by UDOH Institutional Review Board, IRB, and its executives by also Utah Health Data Committee at an open public meeting and by state of Utah executives. So formal review and approval was received from the Census Bureau's Disclosure Review Board, DRB, before release of this and any other results that could come. And the release data contain no personally identifiable information, nor any information that can be made personally identifiable when combined with other sources, outside sources. And also, we'll mention the Utah guidelines on data suppression and data aggregation are met, as well as additional Census Bureau Disclosure Review Board criteria that have been met. So here are results and findings regarding the main social determinants of preventable emergency department visits. So on average, Utah emergency department patients from more vulnerable populations tend to have more emergency department visits, many of which are preventable visits, than do other Utah emergency department patients. So specifically, individuals in lower income deciles tend to have more preventable emergency care visits than those who are in higher income deciles. Individuals who are unemployed tend to have more preventable emergency department visits than those who are employed. Those with less educational attainment tend to have more preventable visits. Those with one or more disabilities. Those who are divorced, separated, or widowed tend to have more preventable emergency care visits than those who are married or never married. Women tend to have more preventable care visits than men. Individuals living in rent-occupied housing tend to have more visits, as well as individuals with who are lacking internet access. So to take one social determinant example, we find a clear income gradient in emergency department use in Utah. The 5 bars here represent quintiles of household income, and we find a higher emergency department use for all types of visits among those with lower income relative to those with higher income. If we look at only the subset of visits that are classified as preventable and not preventable, we see the following. With preventable emergency care visits on the left-hand side and non-preventable visits on the right-hand side, preventable emergency department use declines as household income rises. Likewise, for non-preventable emergency department use, we have a decline in use as we go from low to high income, though it's a bit harder to see on the condensed scale. If we look at the shares of preventable and non-preventable visits relative to the 4 main NYU emergency department types, we find that the share of preventable visits is falling as household income rises. And conversely, the non-preventable, true emergency shares of visits is rising as household income rises. And you can see with the check marks trying to emphasize really what we see in the lowest decile, the lowest quintile versus the highest quintile. So we also produce comparisons of characteristics across populations. On average, Utah patients, especially those with a preventable visit, tend to overlap more with vulnerable groups than does the overall Utah population. So specifically, Utah Ed patients on average have a higher poverty rate than does the overall Utah population. They tend to have a higher unemployment rate. Utah Ed patients tend to have lower educational attainment than does the overall Utah population. They tend to have a higher rate of disability, tend to have a lower rate of being married, higher percent female than does the overall Utah population. And Utah Ed patients on average have a higher share that receives SNAP benefits or food stamps than does the overall Utah population. And finally, we find a higher share that lacks a vehicle among Utah Ed patients than the overall Utah population. So we also studied the linked data set by year and by age. First, by linking year. What we mean here is instead of allowing linkages across any 5 years, we're constraining it to be 13 ACS with 13 Utah, 14 ACS with 14 Utah. And actually we find very similar results, whether we constrain it this way or allow for cross-year linking. And so we'll find very similar results, but of course with a smaller sample size and larger margins of error. So the exact year of the match doesn't seem to matter. The next is regarding age group. So we look at 3 groups, under 19, 19 to 64, and 65 plus. And we find that the results for ages 19 to 64, so that group in the middle, is very, very similar to what we have for all ages, but with a reduced sample size. For the under 19 group and for the 65 plus group, of course, we do find some differences. Children have different patterns than the average person. Seniors have different patterns. So we would expect this for different phases of life. And I want to mention, we also do an examination of the logistic regression models in which we control for all 19 social determinants at once. And we have county effects there. We account for some seasonality as well as day of the week factors. So all these social determinants, all these social determinant covariates in the model are highly statistically significant. We still find the original bivariate relationships between social determinants and ed visits holds up well, just the same as when we have the controls. So in conclusion, this project involved the creation and use of a unique and valuable data set. We have emergency department encounter data linked to social determinants of health at the individual level, rather than what we typically see would be a lot of times at the aggregate or geographic level. For Utah Department of Health, they learn which social determinants are most important for emergency department visit frequency. And this can inform new strategies and methods for reducing preventable emergency care, and potentially could allow for realizing emergency department cost savings and reduction of provider burden. For the Census Bureau, we are creating new estimates related to social determinants of health in an emergency department setting, contributing to the Census Bureau's mission. We expand research opportunities related to social determinants and healthcare utilization and outcomes, and we can help validate American Community Survey content and hopefully seed ideas for related new survey content. So regarding our next steps, we're currently developing an interactive data dashboard, which all public data users can access our summary data with to make their own tables and their own graphs. And I'll show a glimpse of that in a moment, but I want to mention we also are working potentially on some additional extensions of the results that we've provided so far. It's a very rich data set, and there's a lot to be studied. And looking ahead, we also want to continue our communication and partnership with the Utah Department of Health. It's been a terrific collaboration. I want to mention for the eHealth program overall, again, this enhancing health data at the Census Bureau, this program seeks to provide and fulfill additional health data needs that we see. We seek to have new partnerships and collaborations, hopefully with mutual benefit. So please contact us, please reach out. And we have a website coming for the eHealth program soon. So I show the URL there. We're a little ahead of ourselves. The site's not live yet, but we expect in the coming weeks that it will be available. I want to give you a quick glimpse of our forthcoming interactive data dashboard. Now we're just looking at fake data here. It's still under review, but you can see that we have pie charts and some stacked bar graphs and some bar graphs, and one is able to select different social determinants and different age groups to provide custom graphical results. So we have our contact information here. Again, I'm David Powers, an economist at the US Census Bureau, and please also feel free to reach out to Victoria Udalova. She's the eHealth program manager. With any feedback or questions, we would definitely greatly welcome your contact and any feedback you have. So thanks very much for attending. Looking forward to any questions.
Thank you, David, for that great presentation. I'm particularly interested in your paper because I've done some similar work myself, so I thought that was a really great presentation. Our third presenter for the day is Douglas Hilmer, who's going to present a presentation linking ACS data to data from other sources, issues to consider. And I want to remind all participants that you can submit your questions via the question box, and that we're going to be taking your questions at the very end after Doug's presentation. So Doug, you're up.
Okay, thank you. I assume I can be heard. I'm going to talk about a project I'm doing in which I'm trying to link ACS with a lot of other data sources. And I'm going to use my project as sort of an example. So, one second. My first goal is to move the slides here. There we go. Before I start, especially with regard to David Powers' presentation, my use of the word linking has nothing to do with internal record matching, and perhaps I should not have used that word. Basically, I'm talking about data that is publicly available, pre-aggregated data, and that's really what this talk is about. Data coming from multiple sources. I'm going to use my project as a running example in the talk. However, I think the issues I raise are common to projects using data from multiple sources. The talk will just raise more questions than it answers, but I hope it can serve as a beginning for a broader discussion of these issues. So I'm going to cover why linking to other data sources is so important, description of my current project, what is rural, that is the name of it, choosing the other data sources as an iterative process, questions about data sources to link, definition, data collections methods, etc., vintage issues, tools and techniques, and then questions I still have for my project. So why is this so important? Well, this is, I think, rather self-evident. Every major work of social and economic research draws on multiple sources. No single data set has all the answers. Data sets can represent different perspectives and angles of attack on a problem. So I'm going to raise issues in this talk, but in no way do I want that to diminish the importance and the necessity of combining data from a variety of sources. Here's one example. The Consumer Price Index from the Bureau of Labor Statistics. That's not only a long list of sources they draw upon, but that's quite a varied list of sources that they draw upon. So this is already commonplace, but there are still issues that many of us, especially those of us who are newer to this, need to consider. So a little bit about my project. I call it What is Rural? That word rural has been used rather freely, especially during last year's election cycle. Here's an example of one title from Politico, Why Democrats Keep Losing Rural Counties Like Mine. And I went and looked at that county that he was talking about. It's Dunn County, Wisconsin, has a population of about 45,000. It's part of a micropolitan area. It's about a 30-minute commute from Eau Claire, Wisconsin, which has a population of over 100,000. And farming, which we often equate with rural, farming actually plays virtually no role in Dunn County. In fact, it seems that the largest industry there is government. So by way of contrast, I look at what the USDA's, the Department of Agriculture's Economic Research Service classifies as farm-dependent counties. And there's about 500 of them in the country, and they're relatively small. In fact, their average population is about 7,800. So how do they compare to a county of 45,000 like Dunn County with no farming? So that's sort of a starting point for my research. One of the things that is often done is people will equate rural with outside of metropolitan areas. And this, I think, is rather misleading. Let me just review real quickly. By the way, there is an example of a paper that does that. The Census Bureau defines rural at the time of the census. Every block is either urban or rural. That is the beginning of the Office of Management and Budgets process for defining metropolitan areas. Comparing percent rural counties inside metro areas to outside metro areas is kind of revealing. So I did that for Colorado. Turns out that of all the people living in rural blocks in Colorado, 70% of them live inside a metro area. And furthermore, 4 counties in the Denver metropolitan area are in fact all rural. So just using metro versus non-metro can be misleading. One way to attack the problem, once again, back to the Economic Research Service, is to have a finer classification. And what they've come up with is a set of what they call urban influence code categories. Here they are shown, 12 of them. And they basically have to do with how close you are, if you're not inside of a major metropolitan area, how close you are to that metropolitan area or to a small city. This, I think, is a step in the right direction. And this is the kind of thing I want to look at in more detail. Okay, that's my example project. Here's the current data sources I have coming in to the project. So I have 8 data sources so far, and I'll just go through them very quickly. The ACS is there for population housing characteristics, of course. USDA is there, USDA data from the Agriculture Census or from the Economic Research Service is there for farm-related data, but also for characteristics of people living in smaller counties. The Economic Research Service does a lot of work on that. IRS data is there because actually, if you have farm income, there is a schedule you can attach to your 1040 on that. Also, I want to look at the business deductions and business losses. By the way, these are all, I'm looking at everything at the county level. OMB is simply there because, as I've mentioned, they have the process of defining the metropolitan areas, which they do after every census. The 2010 census summary file is there because of its definition of urban and rural blocks. The next three have to do with economic activity in the counties. The non-employer statistics has non-farm businesses with no employees. The county business patterns has non-farm businesses with employees. Then we have the quarterly workforce indicators, part of the LEHD program, and that has both employee and employer data with some characteristics on both sides. So basically it's a jobs file. And those are the 8 right now. I have 2 more I'm actively considering. I'm considering CDC health data, and I'm considering also data from the past 3 presidential election cycles. So election data. So choosing, as I have discovered, choosing data sources is an iterative process. It is iterative because you're always becoming aware of new data sources, and either they are new or they were there, but I just wasn't aware of them. So it's difficult to formulate a hypothesis for that reason, but it's also difficult to form a hypothesis without looking at data. I don't know if this has happened to others, but it's happened to me before several times where I think I understand the data based on the documentation or metadata, and I go look at the data and I realize, aha, no, it's something else. I didn't quite understand it. So this can impact your initial attempt to form whatever hypothesis or research plan you have. And the data sources may not be seen at first, and then you discover them, and you may have to refocus or redirect your research plan. And at some point, you say, well, I'm going to have to now, analyze results, and I just have to acknowledge that some data has surfaced that was too late to be included. I'm going to go through a set of examples, of specific examples of some of the issues I'm encountering now. One of them is county business patterns versus the ACS. So my goal with using the county business patterns data is I want to look for non-farm businesses that may be new, maybe emerging in less populated counties. Now, the obvious problem I encounter is disclosure avoidance, and it has to be there, of course. But in 2017, the Census Bureau changed its approach to disclosure avoidance for the county business patterns data. And they went to the requirement of 3 sample cases per category per county. So now I looked at that and I realized the file size dropped dramatically, almost 50%. And so I had to evaluate, do I have an additional problem here? Am I missing more data? The NAICS codes, North American Industry Code Scheme codes for the industry, are they less represented in these counties than they were before? To evaluate that, I have to look at several years of the county business pattern data, both before and afterwards, at the county level, but also I'm going to look at it at the state level. I want to see if I see certain NAICS categories there, but I no longer see them represented at the county level. So that's one of the problems I'm investigating. Another has to do with a data set from the Economic Research Service called Typology Data. The Typology Data is an interesting set of data. It has 14 indicators, and it's the result of a very large effort to bring together data from about 6 or 7 different sources, one of which is the ACS, but also administrative data, data from the Bureau of Economic Analysis, and so forth. It's a very rich data set. However, it has not been updated since 2015. So my preference is to use the 2015 through 2019 ACS 5-year data. I have to use 5-year, of course, to cover all the counties. But here I have one that hasn't been updated since 2015, and is it still usable? Would those categories, those indicators, change significantly? So I have to consider how I'm going to deal with that. I've contacted the Economic Research Service, and they've told me they're not going to update it until the new metropolitan area definitions come out, which will be no earlier than next year. I also have an issue with the use of the word employment that I'm looking at, and I want to make sure it's being used in a manner consistent with the way ACS uses it. I'm not going to say too much about the next one. I'm just going to say that this is an example of a definitional problem, I guess, in a sense, or perhaps a problem where I don't have the expertise for what I really want to examine. So you can look at qualified business income deductions on the IRS data file, which is a county level file. I have the one for 2018 right now. However, I'm not a tax accountant. And so I need to make sure I'm correctly understanding what's there. So I may actually need to get the help of somebody. The other issue has to do with the question, what do you do when you have a data set pegged at a point in time, a single year, right in the middle of your 5-year period? Is there any sense in trying to harmonize these, like, for instance, building a multi-year IRS file? I haven't made a decision on that yet. So that's an example of different kinds of issues that come up. An interesting problem, going back to the Department of Agriculture, has to do with looking at two concepts and are they the same? I think I alluded at the beginning when I was talking about that diagram. I talked about the county business patterns not covering businesses in the crop and animal production industries, and that's a quote from their documentation. So on the USDA side, the Department of Agriculture, at the time of the census, but the ag census was in 2017, they covered farm laborers. So, and I'm not talking occupation, I'm talking about industries where there was farm laborers. So I'm trying to figure out, do I have the same things here? Does one cover the other, and so forth? Once again, I contacted the Economic Research Service because I reached the limit of what I could do with existing documentation. And this is a real recent update. Yesterday, I got an email back from one of the staff members, a very helpful email, and I believe I'm going to be able to get an answer to this question with their help. In terms of tools and techniques, I really don't have much to contribute at this point. There are lots of tools out that are much more sophisticated than what I'm doing right now. But one simple thing to do is simply say, well, if these are the same things, let's see if we get the same results, looking at both the ACS side and the other data source. In this case, I'm looking at the quarterly workforce indicator measure for average number of workers in New York, in the state of New York in 2019. Now, the quarterly workforce indicators is indeed quarterly, so you have to follow instructions to get an average annual number. So that's what I got. You see it on the slide. The ACS estimate is shown as well. And the good news is that the QWI estimate is well within the 90% confidence interval of the ACS estimate. So it appears like we are basically on the same page with regard to defining workers. So here's some questions I still have. Rural may not be something you could totally capture with quantitative research. Do I need to supplement my quantitative research with some qualitative research? This is discussed a lot in social science literature. Often they talk about what's called triangulation, ways to, and mixed methods, ways to combine the two. Do I know people or organizations to contact when I have questions about data sources? And I think that's very important. The example I gave from the Economic Research Service, is a case in point. they save me hours, if not days of work. Is there a role for real-time transaction data? Now, this has been coming up a lot recently, how people will go to, grab data from Twitter or Google, um, specifically point of purchase data, data on visits to doctors and healthcare providers. For instance, point of purchase data may suggest something about a certain kind of business, and may enhance what I'm getting from the county business patterns. How do I address the missing data problem when I encounter it? That's a big question, and I don't really have an answer to that right now, but it's certainly one that there are suggestions, and we just went to my next slide. So the last thing was I wanted to mention, which I would just add, that when are there data collection methods that may have a systematic bias? And that is sometimes the case when you're dealing with administrative data, and sometimes it's hard to find that, but you do want to know. And I'm already at the thank you. I don't know why they're going here. But anyhow, I'm going to go from current slide, and I'm going to go back one if I can. I wanted to show you two sources here. Yeah. So I have found very valuable. One is for the National Academies of Science. It's a little book published in 2017, multiple federal statistics, multiple data sources, and privacy protection. I found it to be very helpful. Another is a really interesting talk given by a physician, I believe it's a physician, in Florida, and it's about linking survey data together. Then there are two websites that I have been using fairly frequently recently, data.gov and one called AmeriGeo. And both of them are helpful to see, is there something out there that I didn't know about? And then there's always Google, and I use the advanced search feature in Google. So with that, thank you very much. And I'll try to get to that. There we go. Thank you.
All right, thank you, Doug. Appreciate that presentation. We're now ready to move on to the question and answer portion of today's session. So we've got a small handful of questions, and I am going to attempt to ask those in order of the presenters. So we're going to start with a couple of questions for Kate Nesi. So Kate, first question for you. Have you attempted using assessor data and the ACS to measure gentrification?
No, but I think that that is a great next step. That's something that we've been talking a lot about at the city of Bellevue. And in fact, my counterpart, the demographer in the city of Seattle, has developed a gentrification measure that uses ACS data. I should have leaned on her more to come present at the data user group. No, I haven't done that, but that is a great extension of it.
Thanks. Second question for you. Did you generate margins of error for in your parcel-based estimation model?
Yeah, I am a big proponent of using margins of error, but in this case, it's not possible to generate a margin of error because it's combined with too many other things. However, one of the reasons I use the census tract estimates instead of the block group, you could do these estimates of vacancy and household size at the block group level, but the margin of error is much smaller at the census tract level. That's one reason I use the census tract stats. In addition, I mentioned at the end, I don't make the estimates for anything smaller than around 1,000 parcels, because when you get down to, a handful of parcels, it's really chancy. It's not going to be reliable. So, if you're making these, if you're reforming things and they're census tract or larger, areas, then I think that you have a reasonable basis, and your error is probably going to be something like what the census tract error is, for the characteristics that are included.
All right, thanks, Kate. Next couple of questions are for David. So David, question is, does marital status remain relevant to emergency room visits after age is controlled for?
Yeah, so what we did in the regressions is we had age groupings. So we did not include age as a continuous predictor. It would be interesting to try it in that context. But when we use the groupings, so for example, actually, we don't have children, certainly in one version of the model. What would be the marital status of children? Doesn't really, it's not kind of in scope for children. But we do groupings kind of like 19 to 26, 27 to 54, 55 to 64, 65 plus. Marital status continues to be significant even when we have those age groupings.
All right. Another question. This one's coming directly from me. I have done a project that was very similar to what you guys did at linking administrative records from HUD rental programs to the ACS. So one step we took in that process was to determine if when we matched the HUD rental records to the ACS, we calculated the number of weighted ACS housing units to see if it matched with the number of HUD records that we had, and that to us was an indication of the quality of our match. So knowing that on the emergency room visit side, you only were able to get pick matches for 97% of your records, and on the ACS side, 94%. We know there's not gonna be a perfect correspondence, but question is, did you guys, once you identified the people who had emergency room visits in the ACS, did you produce a weighted count of those people and then compare it to the number of administrative records you had to see if you were picking up everybody?
Sure, it's a great point. So we, again, first have a 3.5 million record visit file. So it's a very large data set, and it has its own characteristics. And so we summarize those. And then we have the link file, and there's linkage for there's a pretty good link rate, pretty good pick rate, and then a pretty good linkage rate between the ACS and Utah. And we did some basic benchmarking. I don't mean that we didn't scale data up or down to match a benchmark, but we did compare some of the figures before, pre-linked and then post-linked. And so we were fairly close on the counts we were looking at. We don't have, I don't have the numbers to exactly report, but I think it's a great point. As we think of future updates that we can give, I think it's nice to put them side by side. So for an example, when we look at preventable and non-preventable, right? So number one is the headline number. So you got 3.5 million unweighted, right? You know, how close are we for the weighted counts? Again, ballpark, but I'd like to be able to report the exact number. Same preventable and not preventable. Again, we're fairly close to those that we see in the non-linked file, but again, I'd like to be able to provide an exact number. So we'll look to try to augment our work with maybe a table showing those two, because I think it is helpful to know how representative is your weighted sample compared to what you had in the original AdRec.
Yep, exactly. That's the point I was going to make. If you can show that your match is picking up, 97% of the expected number of people, then you can almost dismiss the bias issue because you're picking everybody up. We got another question for you. In Utah, how did you gain access to the person level data that you referenced, and what would be the process for a state agency to access person level census data for similar analyses?
Well, it was a very comprehensive and long-term project for the Census Bureau to speak with outside stakeholders to try to see, are there health records that we could acquire and that we could link with our data? So it was a very careful, involved process. We spoke to representatives at Utah Department of Health in many contexts, and we heard what they were looking for. We wanted to make sure that we would meet their needs. So it was It's not easy to acquire obviously sensitive microdata, especially health related. So we had policy people talking, of course, we had legal people talking, and in the end, we're able to create this unique data set, but it was a lot of footwork at the front and even for many months before it really yielded results. But obviously we're happy it did, and we think we could do this in other contexts. So right now, as we say, we'll have an eHealth website, and that's kind of a call to others who might, other partners that we might have that have health data that might be relevant to Census Bureau. Census Bureau might have data that might be very useful to attach, for example, the different variables in ACS or SIP, Survey of Income and Program Participation, current population estimates, current population survey. So we're very open to meeting and talking to new data partners, and we could talk about what they're looking for and what we can provide. But so we hope that we can replicate. So this is one of the earlier efforts. We actually have some other efforts right now in the pipeline, other groups that we're talking to. So we hope that what we've done here with Utah, we could do with other partners as well. And in fact, we're seeking such partners.
Excellent. Thank you. Next question is for Doug. So Doug, have you looked at any of, in your research on rural, what is rural and rural issues, have you looked at any of the recent nationwide surveys that have been conducted on, that have just simply asked people whether or not they would describe their neighborhood as urban, suburban, or rural?
I've started to look at some of those. And that's why I mentioned that you may not be able to totally answer this question with only quantitative data, because there's a qualitative aspect to this. I should say, I myself am a neophyte at bringing together data from multiple sources. And so what I'm talking about is something I'm in the process of doing. Like for instance, about 2 months ago, I didn't know anything about what's called triangulation in the social science community. So I'm learning as fast as I can. But yeah, I have read about some of those, and I do think there is a lot of perception involved in what we call rural. The only thing I want to mention, though, is that there are also major decisions made on what people think is rural. And some of those are policy decisions. And the one reason I want to do this project is because I think we must have a better way to talk about urban and rural. The one, I just want to mention something I didn't have time to mention in the slide. A rural sociologist named Daniel Lichter has for years been talking about the need to have a much more of a sense of a continuum from urban to rural. And that's what those Economic Research Service urban influence codes are all about. So yeah, I think that there is a qualitative aspect to it, and I think I wanted to learn more about that, but we definitely need to have some finer delineation, I would say, in our definition.
Sure. All right, I'm going to move back to Kate. Kate, have you tried to use your method to project the effects of growth in housing stock, such as measuring the effects of proposed changes?
I haven't done that. So it's kind of a two-part. I haven't done it with this method specifically to answer a housing unit population question, but for transportation in Washington State, in counties like King County, we have to do transportation analysis to make sure that we have enough capacity in our roads to accommodate growth, housing unit growth. And so I have produced estimates for that particular model. I think, I mean, and it's a very similar method, but not exactly the same. I think it's a good idea and a good extension, because the things that are in that model don't change a lot. Household size doesn't change year to year very much at all. And it's really just the housing units and the type of housing that's going in that is dictating the population that's going to be in that area.
And thank you. And another question for you. Is it accurate to say that all of your adjustments are ratio adjustments? There's a broader literature on small area estimation that uses regression models and mixed models.
Yeah, I stayed away from the regression models because, you know, before I was a demographer here, I was at universities, a professor at universities, and one of my goals is to have methods that people can apply in practice. And so as soon as you start getting into regression models, then it stops being easy to implement and easy to explain to your city council. So I've stayed away from those models.
And I think there's another question here that I think is for you, Kate. Have you compared your results to OFM data? I don't know what OFM stands for.
Yeah, it's the Office of Financial Management. And yeah, that is, and it houses a population office in Washington State. Yeah, that's, so I took their estimate as the accurate one and compared my estimate to their estimate, and found that my estimate was, at least for Bellevue, was less than 0.5% different. And so it was very close. You know, that's one city. I need to verify that with, you know, more than one, maybe all of the cities in King County.
All right, we have one more question for David. David, I think you alluded to this a little bit on your prior answer, but how does a state agency gain access to individual level ACS data? Is it a process through state census information centers?
I think that could be one way to reach out. First of all, we're eager to hear, regardless of the channel that it comes into us. So yeah, I think there's FSCPEs, state partnerships that are there, state data centers. I think there's lots of folks that have contacts with the Census Bureau that would be happy to relay the question and ask about what's possible. So there's many ways to reach us. Of course, we have our contact information on our slideshow, so we'd be happy to just begin a conversation. And but yeah, there's many channels, and there's not one way, but the more people you know, probably the easier it is to start a conversation.
All right, thanks for that. And Doug, back to you with a couple of questions.
Okay.
First question, do you have any idea how OMB's proposal to redefine non-metro areas affects your measure of rural?
I don't know about the revised proposal right now. I didn't keep up with the 2020 proposal right now. I do know that from 2000 to 2010, the definitions, it had a very minor change on the counties. So it didn't have a significant change in classifying the counties. I don't know. Yeah, now of course, well, I might be speaking, that might be a little off. I mean, I can't remember when it started that they went to what are called core-based areas, but mainly in terms of is something in or out, whether or not it's micropolitan or metropolitan. If it's out, it didn't change too much from the 2000 base to the 2010 base. I think it's, I don't know the exact number, but I think it's maybe 70, 80 counties switched. I don't know about the current one right now.
So I can actually help answer that question, because I, for my agency, had to do some assessment of that. And OMB's proposal in there, or not OMB's proposal, it's the committee that they formed to make recommendations. They cited 144 metropolitan areas that may become micropolitan areas if their proposal is adopted. I don't think it's going to be 144. It's going to be a little less, because some of those are going to remain metros. But it's a fairly large number of metropolitan areas that would be reclassified as micropolitan areas. I
That-
put that number somewhere around
Right.
130.
That's true, but if you look at that urban influence code scheme, one of the things I would like to do, or maybe somebody's already doing it, whether or not they're metropolitan or micropolitan, I'd like to see the counties and their proximity to those areas that are outside of both of them. A good example, by the way, is Sullivan County, New York. Sullivan County, New York is outside of any metropolitan area or micropolitan area in New York. It has 77,000 people. Across the river, Delaware River, is Pike County, Pennsylvania, which has 50-some thousand, and it's inside the New York metropolitan area. And they are very similar in terms of their makeup. I looked at both of them. So I'm kind of coming at this from a different perspective. I'm thinking, and right now this is not yet formed as a hypothesis, does this really have more to do with proximity to markets than it, and I know that's a factor. I understand that's a factor in the whole OMB process, but I want to examine that in more detail.
Another question for you. Let's see here. Doug, there may be a Kate assessor style answer to the what is rural question. The tallest building in the place or county, even if it's residential or business. Any reaction to that?
I admit I have not thought of that measure. Yeah, well, I mean, there's some sense to that, but you got to remember that there's some grain silos that are very tall. So, so there might be, but no, I will admit I have not thought of that measure.
So that's actually an interesting point. We mentioned before the surveys on urban, suburban, and rural. I helped do some research on one of those, and we put together a model looking at what are the predictors of people's response to that survey question. And one of our right-hand side variables was, is there a skyscraper in the census tract in which the person resides?
Yeah, right.
Skyscraper being, I think, 100-foot or taller. And that had no predictive power on how somebody described their neighborhood.
Okay.
It's one survey, one measure, but maybe a little bit of a signal that tallest building is not the most important thing.
Not the most important. I'm glad to. I guess I'm relieved to know that. But the exurbs. Don't forget the outer suburbs. I mean, my guess is as farther out we go, the average height of the buildings goes down. So that may not be true. Montgomery County, Maryland, where I live, we have these suburbs where there are some pretty tall buildings. So but if you go to further out, and the exurbs have become very important recently. You remember the big discussion about how they were voting and so forth and so forth. But I would imagine the further out you go, the less tall the buildings are.
And one more question for you, Doug. Have you looked at the National Center for Education statistics locale categories?
I have looked at them for a different talk I'm giving on Thursday. So I extensively that's on educational attainment. But what was the categories? I didn't quite catch.
The National Center for Education Statistics locale categories.
Locale categories, yeah. No, I haven't. I don't know what exactly a locale category is. So I admit to ignorance on that one. I'll make a note of that. It's a good point.
Can I ask a question, Sean?
Oh, sure, Kate.
So, or it's more of a comment, because I have also looked at the rural urban question, having spent a lot of time in the rural Midwest and small college towns. And I think that it really needs to be, if you're looking at the county level, you need to look at east of the Mississippi and west of the Mississippi. As somebody out west, characterizing an entire county as rural or urban,
right,
is really difficult to do.
Right, that's a good point. What I want to do, of course, at some point is be able to see if there's some way that around, some of these counties, once I have all the characteristics brought together, if there's some way that they will start to cluster and common themes, and one of them, of course, is, well, is there a geographical similarity? Are they, like you said, east or west of the Mississippi or something else? But yeah, I've made a note of that. That may be too. Maybe that's revealed in some of the qualitative stuff that I'll be looking at.
Yeah, I'll emphasize what Kate said there. We found something similar in our research on what are the predictors of how people respond to that survey question. And east of the Mississippi, west of the Mississippi was a pretty strong predictor.
Interesting. Thank you.
All right, so I am not seeing any additional questions in either the chat or the live Q&A, and I'm out of my own questions. So I think with that, we will go ahead and wrap it up a couple minutes early. I want to thank all of the presenters, Doug, Kate, and David. Wonderful presentations, very, very interesting topic. Topics that are all near and dear to my heart. So thank you guys very much. And I believe there's a break between this session and the next session.
Bye-bye.
Thanks a lot.
Bye.
Bye.